All right. Good afternoon, everyone, or morning or evening, depending on where you're tuning in from. My name is Ashley Cruz, and I'm the Events and Engagement Officer here at the Mental Health Foundation. So, before we begin, I would like to acknowledge that what we call Alberta is the traditional and ancestral territory of many First Nations, Métis, and Inuit, who for generations lived on and cared for these lands. Our work takes place on the historical and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, and a portion of the Métis homeland, including regions 1 through 6. Since we're in a virtual environment today, I would also like to acknowledge that no matter where you're tuning in from, we offer respect and gratitude for the land. We are very excited for today's session, which is all about sleep. Our hope is that you walk away with a deeper understanding of just how important sleep is for your mental health and total health, really, and that you also gain some actionable takeaways to start sleeping better right now. If you enjoyed today's session, at the end, I'll also share some ways to stay in touch or get involved with the Mental Health Foundation, as well as a short 5-question survey to get your feedback. So please be sure to stick around until the end. Now, I'm pleased to turn it over to our platinum sponsor, Ellis Dawn, who's been our presenting partner for our entire 2024 Lunch and Learn series. We're so grateful for their support in making this series possible, as we truly couldn't do it without such a dedicated partner. So I'll hand it over to Nicole Butson, who is the Assistant Manager of People and Culture at Ellis Dawn, to say a few words.
It's Ashley. Hi, everyone. First of all, I just want to thank each and every one of you for being here today. As Ashley said, it's so important for all of us to get like this and just remember what it's like to take care of your mental health, and sleep is so important when it comes to that. So, like Ashley said, for those of you who don't know me, my name is Nicole Betson. I'm the Assistant People and Culture Manager working for Ellis Dawn, and I support our Edmonton area. So just seeing the amount of people who have joined today proves the importance of mental health in our personal and professional lives. And really, it's a topic that deserves our time and attention. At Ellis Dawn, we believe that fostering a healthy workplace means supporting both physical and mental well-being. And in our fast-paced industry, sleep is the one thing we often tend to sacrifice. I know I do, and it's so easy to let work and our personal lives get in the way of making sure that we're keeping up with our sleep and well-being. So Ellis Dawn sponsors events like this because we want to make our employees and the people in our community just to feel more empowered and make small, meaningful changes. And I hope that everyone takes something valuable away from this webinar today that promotes better sleep and better mental health. So again, thanks for everybody joining today. Just your presence is a powerful step to building a healthier and more balanced lifestyle. And I'll pass it back to Ashley.
Thanks so much, Nicole. We're so happy that you're here and supporting this incredible series. So I'm thrilled to introduce our facilitators today, who are Anissa Gill and Kathy Mercier, who are both health promotion facilitators with Recovery Alberta, formerly Alberta Health Services, with the professional practice and education services in the Edmonton zone. So Anissa is a registered social worker supporting adults and older adults who face mental health and addiction challenges in their lives. Anissa is also a sessional instructor at MacEwan University in the social work program. Kathy brings experience in providing community support and psychoeducational materials to children, youth, adults, and families in the areas of mental health and addictions. We're so thrilled to have them here. They've been here with us for our entire 2024 series as well, including the first one we did in 2023, actually, near the end there. So Kathy and Anissa, I will pass it over to you.
Great. Thank you so much, Ashley. Thank you, Nicole, for the lovely introductions. I'm just going to go ahead and share my screen here. Just bear with me. Okay. Whoops. Sometimes I always have that issue when I am sharing. So with that, awesome. Thank you, Kathy. So with that, thank you for joining us today on Sleeping Your Better Way to Mental Health. Right, so we're going to be focusing on sleep and strategies that can be helpful to improve that if you are struggling with it. So as Ashley was saying, my name is Anissa. I'm a health promotion facilitator with the Professional Practice and Education Service team for Recovery Alberta in Edmonton. And my co-presenter today will be Kathy, and she'll be joining us in the second half, and I'll be completing the first half of today's presentation. I will sort of pass on with the territory acknowledgement. Ashley did a great job in covering it, but we do want to acknowledge that we are gathered here from different areas of our province in the territories: Treaty 6, Treaty 7, and Treaty 8, and 8 Métis settlements and Métis nations of Alberta. So this information is designed for educational purposes only. It should not be used in place of medical advice, instructions, and or treatment. So if you have a specific question, please contact your doctor or other healthcare professionals. So today we'll be looking at the importance of sleep for overall health, including mental health and well-being. We will look at factors that interfere with our sleep quality and sleep quantity. And then lastly, we will discuss various helpful sleep hygiene strategies that can support us in getting good sleep. So with that, you may want to grab a pen and paper to write down anything that you may find helpful, as well as some of the information we will share at the end. So let's begin by looking at the importance of sleep. We all know that sleep is important, and we feel and how we feel when we don't get enough of it. But we may not realize how it is essential to our overall wellness and health. So if we think about the most important things we can give ourselves and those we care for, sleep definitely makes the list. Right? So sleep is a fundamental human need, just as important as your family's health and wellness, even to your survival, right? Such as food and water, love, and connection. So unfortunately, ensuring that we get enough sleep can sometimes be challenging. So sleep is important for our physical health. It contributes to healthy growth and development, allows the body to renew and repair itself, and is necessary for our immune system to work properly. So sleep plays an essential role in cognitive function. So in other words, how our brains work. So sleep is needed for brain growth and development and matters for memory, attention, and problem solving. Sleep is important for mental health too. So it helps strengthen those brain connections involved regulating in our emotions, improving our mood, and dealing with stress. So sleep loss has been linked to elevated risks for cognitive and mood disorders. So when our sleep isn't long enough or isn't of good quality, it can impact everything. So see if you can identify with this situation. We're going to be showing a video from the sitcom Seinfeld. So let's take a look.
Anissa, I don't think your sound is being shared.
Oh, I'm so sorry. Let me see if I can improve that here. Give me a moment. Yeah, it's not allowing me to improve the sound here, so I apologize for that. So hopefully maybe this clip can be shared a little bit later on, but for those who can hear it or turn up the volume in your computer, I'll now quickly briefly go through the scene as well. So sorry about that. So again, I apologize for the sound not working too well. So the character of Kramer, he comes in, he's wearing his little robe there, and he's just really struggling with not getting good quality or sleep or not getting good quantity. So he's not getting into that zone. It's either too hot in his room or too cold. And so you can see the impact of not getting good sleep, right? He's struggling, just lumbering into the apartment. It's just a humorous video, but something that, some of us can struggle with when we're not getting that quality sleep in our life. So maybe you felt like Kramer in the video where you, for whatever reason, you just can't get into the zone. Right? That will allow you to sleep. Right? So for Kramer, he couldn't sleep without his special quilt. And for some people, they need their own bed or that complete darkness. So I have a question for everyone here. What are some of the things that you need to be able to sleep? So feel free to share in the chat. I'm curious, what does that look like for you? Okay, somebody mentioned white noise. Yes. Yeah, your fan. Yeah, a cooler room. So having just the temperature down a little bit. Somebody mentioned a weighted blanket. Yes, that's kind of going around using the weighted blanket. must be cool and dark, a comfortable mattress. Somebody mentioned having the dog snoring, right? That's why noise. That's pretty funny. Yeah. Having your pets around, that gives you a bit of comfort. Yeah, just feeling secure and tucked in. And then somebody mentioned no technology. Right? So no technology even in the room, even if you have your, phone is off or your laptop or tablet, just removing the technology from your room. Yeah, yeah. Fan is always on. Doesn't matter what time of the year. Yeah, that special quilt, much like Kramer, right? So fresh air and darkness. So thank you everybody for sharing. So as you can see on the screen, all those sort of various strategies or useful techniques to make us feel a bit comfortable, right? And it's clear that everyone is different, right? There's some people that seem to be able to fall asleep anywhere, and others need at certain conditions in order to be comfortable and able to fall asleep, right? And so sometimes you have folks in your life, they just shut their eyes and they nod off wherever they're at. And some of us need a bit of that sort of cozy sort of environment, all those things that make us feel a bit better in order for us to get to sleep, right? Thanks, sharing. Thank you everyone for sharing. So in Canada, 20 to 25% of adults are not getting enough sleep. It's a bit alarming. So when we don't consistently get enough sleep, we may start to develop some of the signs of sleep deprivation. So sleep deprivation includes the amount of sleep we get as well as the quality of our sleep. So when we think about short-term effects, a lack of good quality or good quantity of sleep may lead to changes in mood, irritability, having less energy than usual, or having difficulty concentrating or remembering. And in the long term, when we look at the long-term risks, the cumulative effects of sleep and sleep disorders have been associated with a wide range of health consequences, including an increased risk of hypertension, diabetes, obesity, depression, heart attack, and stroke. Right? So this underlines the importance of sleep to our overall health and now across the lifespan. And lastly, something to consider is the effects of microsleep. This is where we are so tired, we actually nod off for a few seconds, right? We're just shutting our eyes for 1 or 2 seconds and we may not realize it. And this is very dangerous when we're driving or operating heavy machinery, right? So being aware of those microsleep moments. So let's watch. Hopefully, I can't guarantee that this video will work again. And if not, we can sort of describe what's going through this clip. So here we go. And again, this sort of discusses those short-term and long-term effects that can arise from a lack of sleep over time.
Hi, Anissa again. Sorry, I don't think anyone has any audio on this, and so
Okay.
you might want to skip through it.
I'll skip through this. Yeah. So basically just describes what the importance of sleep is, right? And what we sort of shared in the last couple of slides is it's important, right? And we're not giving it that due recognition that we need sleep, right? We are human. And sorry about that. Some glitches along the way. So as you can see,
Anissa, sorry, just one thing I want to point out from that video. It talks about that when we actually don't have a lot of sleep, and they've done some studies, people who are only getting 4 to 6 hours or 4 hours of sleep a night, they were finding that they were having response time and like behaviors that made them the same as if they were legally drunk. So again, we might think that we can get by on a lower amount of sleep, and some days we might feel like we still are okay, but in reality, we still are impaired when we don't have enough sleep, and it can really impact us in so many ways.
yeah, that's a good takeaway. Thank you, Kathy, for reminding us. Yeah. So if we're continuing to get those 4 to 6 hours, it does affect our overall well-being, and it becomes a safety risk, right? So that is something to be aware of. Okay. So then, as we know, as Kathy was mentioning, we need that good sleep quantity and quality of sleep. But how much and what kind of sleep is good sleep? So let's take a look. So I'm going to ask everybody here to share what their answers are. So how much sleep right, do adults who are between 18 and 65 years of age need? Is it 7 to 9 hours, 6 to 8 hours, or 8 to 10 hours? So feel free to share your answers in the chat, and we'll take a look at what the answer is. Okay. That's some answers coming in pretty quick and heavy. Here we go. Whoop. Yeah, perfect. So let's take a look at what the answer is. And I think most of you said 7 to 9 hours of sleep, right? But keeping in mind, every individual may have their sort of unique needs around sleep, but the overall average is 7 to 9 hours, right? So we want to ensure we're getting those hours of sleep on a day-to-day basis. So then what about our kids, right? This recommended amount of sleep for children ages 5 to 13 is 9 to 11 hours. So they need a little bit more, right? And this includes those naps. And developmentally, by the time children are 6 years of age, they probably no longer need those naps. But if they do continue to nap, it can interfere with their nighttime sleep hours. So if they're sleeping during the day, it does affect their sleep at night, right? So our kids need their sleep, but 31%, right, are getting less than the minimum, right? So nearly 1/3 are getting less than 9 hours. So for teens, we think of them as little adults, right? That can get by with less sleep. But for teens, ages 14 to 17 years of age, rather, the recommended amount of sleep is 8 to 10 hours. Right? However, 70%, and that's a lot, are not getting enough of the required minimum amount of 8 hours, right? So some of those stats just to think and ponder on, right? Children and teens. So children, 1/3, 70% of teens are not getting enough sleep. So that's the quantity of sleep that we need. Let's now talk about sleep quality and how the type of sleep you get can impact your mental health. So there are 4 phases of sleep that we go through during a full night's sleep that provide those different benefits we were talking a little earlier on. Over the course of the night, your total sleep is made up of several rounds of the sleep cycle, which is composed of 4 individual stages. So in stage 1, right, we're falling asleep. Our body and brain actively slows down. In stage 2, we enter light sleep where our muscle activity and breathing slows, and our body starts to cool down. In stage 3, this is the deep sleep where we get that physical renewal. This is where a lot of the healing occurs, and it includes a cell regeneration and tissue repair. And then lastly, stage 4, which is that REM sleep. So REM stands for rapid eye movement. And this stage is often known as the dreaming phase. So you may notice when someone is dreaming, their eye movement is moving under their eyelids. So you can see some of that movement happening. And this is the stage where our brains become very active and where we get that cognitive, emotional, and mental renewal. So this graph that you see on your screen shows how we cycle through these stages as we sleep. So you may notice that early in our sleep, more time is spent in the light and deep sleep stages. But as our sleep continues for 5 or more hours, we begin to cycle more quickly into that REM sleep, right? And then we have more of it. So if we don't get enough of this type of sleep, our bodies will not get some of that physical renewal, but not the mental and cognitive renewal that we need, right? So we might get that physical renewal, but not the mental and cognitive renewal. And this is why we need to sleep long enough to ensure we get quality sleep for good mental health. So what is getting in that way of good sleep? I'm curious. So feel free to share in the chat. What's getting in the way? Right? Some things that you can think of. And you mentioned, I think, some of those sort of technology pieces. What's getting in the way of good sleep? Stress. Yeah. I'm hearing a lot of, stress in everyday life, racing thoughts. Yeah. Or just our mind can't shut down. And for some people who might be sort of using their phones, TikTok, and those social media apps, right? So we might be just scrolling through them. And again, it's affecting our capacity and our ability to fall asleep. Yeah. Not wanting to give up personal time, active mind. A few of you mentioned your animals are bothering you. Yeah, so if you have animal cats who like to kind of sit or pounce on you on your bed and you're trying to get to sleep, or we have somebody mentioned dogs snoring, so that really affects children, right? So sometimes children might be coming into your room and they're having some issues, and so that's preventing you from getting to sleep, let alone your children. Yeah. Now, if you have some late plans that are happening, so if you're doing some activities later in the night and you're not used to doing it. One of you two mentioned using alcohol, right? So for some people, alcohol may help them nod off, and some people it may keep them activated, right? So their brain is reacting to alcohol use. And some people mention hormonal changes, right? So as we get older, our bodies are changing. Yeah, so thanks everybody for sharing. Again, really the key is to see all those sort of different various things that really prevent us in getting good sleep. And they look so different, and you may have a combination of them, but just being aware of what that looks like. Okay, so speaking of things that can get away from our sleep, here's an image from NASA, and it shows North America all lit up, and that's at nighttime. Okay, so this highlights how artificial light has changed our sleep habits. So in the past, people spent more time outside and went to bed sooner than when it got dark because they had no other choice. So now with electricity, we often work indoors under artificial light and during the day, and we keep our homes brightly lit at night. Right? So we live in that 24/7 hours our culture where lights are happening, electricity is on, we're getting media. And it's just something to be aware of how that actually impacts our own body and our well-being. So artificial light or having lights on at night does impact our capacity and our ability to sleep. We're open 24/7. That's the culture we live in. So another factor that can contribute to poor sleep are those mental health conditions, right? Some of you mentioned stress and worry, anxiety. So research shows that children were diagnosed with a mental health condition such as anxiety disorders, right, and ADHD, and substance use, and autism spectrum disorder, right, as well as other mood disorders, right? They experience more sleep problems than the general population. Right? So although research has shown a link between poor sleep and mental health challenges, it's not always clear whether sleep impacts mental health or whether mental health impacts sleep. Right? Something like which came first, the chicken or the egg? Right? So the good news is we really don't know what the answer is in order to still do something about it. Right? We can still do something about it. So studies suggest that approximately 1 in 4 Canadians were dissatisfied or with the sleep in the years leading up to the COVID-19 pandemic. The 10 to 15% of Canadians reported symptoms of insomnia, while 6 to 10% met the criteria of insomnia disorder. So that means that roughly 2 to 3 million Canadians could be struggling with some kind of sleep disorder. So those include insomnia. You also have that difficulty falling asleep or staying asleep, restless leg syndrome. So it's a movement that can be uncomfortable and unpleasant. So the tingly or feelings or itchy. And again, impacts the ability to fall asleep. Sleep apnea, right, which are those sort of multiple pauses in breathing during sleep. So people with sleep apnea may snore loudly, experience restless sleep, and maybe feeling sleepy during the day. Okay, so sleep apnea is also linked to higher risk of more serious risk of health issues. And we also have those sleep terrors and sleepwalking. And that happens a lot with children, right? And again, that disrupts a lot of their sleep at night. And then lastly, narcolepsy, right, which causes people to experience excessive daytime sleepiness and uncontrollable sleep attacks, even when they get enough sleep. And this can lead, again, impacting the ability to fall asleep or if they are falling asleep due to narcolepsy, causing those serious disruptions in everyday life. So if you suspect someone in your life or yourself is struggling with some of these disorders, please reach out to a healthcare professional or doctor. Okay, so when there are other struggles and stressors that show up around bedtime, right, and those various bedtime struggles can include, right, not wanting to go to bed, right, experiencing nightmares when they're asleep, not being able to settle into sleep, having difficulty sleeping alone, right? And so for some people, frequent night wakings. And so that's also a concern. The one point about not wanting to go to bed is that it's just something that happens, not just happens with children, but with adults, right? And there's this new sort of term that's been coined called revenge bedtime procrastination, for people who don't feel they have much control over their daytime life or schedule, put off going to sleep early in order to regain some sense of freedom or personal autonomy during late night hours. And so these bedtime struggles can be successfully addressed and reduced through sleep hygiene strategies that we'll discuss today. Kathy will be providing those strategies. So if bedtime struggles continue after implementing consistent sleep hygiene, please consult with your physician and mental health professional. So before we talk about sleep hygiene, we know that many people turn to medication when they're experiencing disrupted sleep. So this may be medications that are advertised as sleep aids, certain psychiatric medications that are prescribed to help with sleep, or certain cold medications that are designed to help people sleep. And then there are meds that can affect our sleep, such as regular prescriptions or certain over-the-counter medications. They are also supplements that many people take that are thought to assist to have better sleep. So those are some things to consider. So all I want to say about medication is that when we are taking them, and whether they may be prescription, over-the-counter drugs, or those natural supplements, it's important to talk with your doctor and pharmacist about what's right for you and how these medications could impact your sleep and wellness. So when we're having difficulties around our sleep, it does affect other areas of our life, right? Such as thinking, our emotions, our ability to perform, our relationships, just basically everything, right? Everything in our life. However, sometimes all that is needed is some attention to our sleep hygiene. So sleep hygiene refers to those healthy habits and behaviors and environmental factors that can control to help ensure a good night's sleep. So when having sleep challenges, we can start addressing them by examining our current sleep hygiene practices and bringing in new strategies to improve the way we get ready for sleep so we can sleep better. So today we're going to be looking at those sleep hygiene strategies of scheduling time for sleep, right? Preparing for sleep, and then creating an environment that promotes sleep, keeping that in mind. Okay, so with that, I'm going to hand it over to Kathy to talk a little bit more about sleep scheduling and sleep strategies that we can use when we are, wanting to, move into that sleep area. So take it away, Kathy. It's all yours.
Just one moment here. I was getting myself set up. Okay, almost there. All right. So remember when we talked about how much, sorry, am I here? Okay. Remember we talked about how much sleep that adults, kids, and teens need? It was like 7 to 9 or 8 to 10. Each of those numbers was a range. So again, adults 7 to 9, teens 8 to 10, children 9 to 11, and even the younger kids, our early childhood years need more than that. So just because you or your kids might be getting sleep that falls within that appropriate range, it doesn't mean that we're getting the sleep that we need necessarily. For example, if maybe you're someone who is getting 7 hours of sleep consistency every night, but you still feel tired. Maybe that's because you are a person who might need that 9 hours of sleep every night. So how do we find out how much sleep that we need personally, or how much sleep our kids need? To better estimate optimal sleep hours, we need to do a little detective work. So this is something that it might be easier to try on a long weekend, or when you have vacation, when you can allow yourself just to sleep. So to find out how much sleep we need, we want to first try just going to bed at a reasonable time when we're feeling tired. We notice we're feeling tired, and then allow yourself to wake up naturally without an alarm clock. Then we want to have a few days where we can do this, repeat this for a few days. And then each date, note how many hours of sleep your body naturally is getting, how much it's sleeping. If you're getting a similar number every night that you just allow yourself to naturally fall asleep and wake up, it's probably the number of sleep hours that your body usually needs. Of course, we know that sleep needs can change over time. Somebody mentioned in the chat that getting older, they've noticed changes in their sleep. Yeah, as we do age, our body sleep needs can change. Sometimes we need more, sometimes we need less. The key is not to assume, though, that just because you're sleeping within that range that you're automatically getting enough. You got to pay attention to what your body is telling you and check that out. And lastly, once you become aware of your optimal sleep hours, you got to make sure to build your schedule around your sleep instead of building your sleep around your busy schedule. I know that's easy to say and hard to do, but sleep is just that important. We want to try and manage our schedule so that we can get the sleep that our body needs. We will find that the rest of our days are much better for it. So here's a question. Let's put your answers in the chat. Let me pull up the chat here. Okay. If I've discovered that I wake up naturally and do my best after 8 hours of sleep, and if I know that I need to wake up by 6 a.m. to get ready for and on time for work, what time do I need to be asleep at night to get my full 8 hours of sleep? Put your thoughts in the chat. So I need 8 hours of sleep. I've discovered it's the best optimal sleep for me. And I gotta be up at 6 a.m. if I want to be ready for work. What time should I be asleep by? Like snoring, like asleep. Okay, any thoughts, guys? See, answers are coming in. We've got, yep, that's right. So I think some people are putting 10, some people are putting 9 to 9:30. Okay, yep. Somebody says, have to be asleep by 10, but prepping at least 30 minutes before. Exactly. So the answer is 10 o'clock. So I know for many of us, that seems really early. We've got lots to do. Maybe we've just settled the rest of the household down, or maybe we've just kind of gotten back from our daily activities and or evening activities. And so we just like, oh, now I've got like to do the dishes, or I've got to get that laundry in, or I've got to answer those emails or whatever it is. But again, we need to, if we need 8 hours, we got to be up by 6, we got to be asleep by 10 p.m., not getting ready for bed by 10 p.m. But like people said, we got to actually maybe settle down a little bit earlier in the night so that we can get our full sleep. And of course, this can seem unrealistic for us at times, and we know that's easier to say than do. But if we pay attention to our optimal sleep hours, at least it'll give us something, to aim for. It's something where we go, you know what? Let's not stress about it too much on nights where we don't get it, but let's go, you know what? I'm going to try and adapt some things in my life so that I can at least increase my chances of getting the sleep that I need. Okay. So let's give it a try. Let's try to pay attention to our bodies and honor our bodies and ourselves. So to be able to adjust your sleep schedule, there's a few things that you might need to adjust in your routines. First, and some people mentioned this in the chat about things that keep us from sleep are our activities. We want to try to avoid overscheduling. Again, I know, easy to say, not easy to do, but do that for ourselves and for our family. It's hard to be ready to get to fall asleep if we're supposed to be in bed by 9:30, but our hockey game went till 9 o'clock. It's just really important. We want to try to balance our daily activities with our sleep needs, and sleep shouldn't be that afterthought or that thing gets shoved into our schedules, or we don't even think about it in our schedules. Let's actually put that in there and try to recognize our needs. If we do find that we want to try to make some adjustments to our sleep, maybe I've been getting to bed at midnight and now I want to get to bed at that 10 o'clock time. We need to really make adjustments gradually. Because if you try to make a big change all at once, it's likely you're not going to be successful, right? You'll be just lying in bed, not being able to sleep. So if we're going to try to move our bedtime earlier, for instance, we want to make that change, gradually moving our bedtime in maybe just 15-minute increments. And so I'll try to go to bed 15 minutes earlier tonight, and I'll stay at that time for a few days or for a week. And then after that, I'm going to try and move it 15 minutes earlier again, and then keep on that schedule for a few weeks. We have to do it very gradually over time. And one of the reasons we want to do it gradually too is we just don't want to lie in bed too long before our bodies are ready for sleep, because that actually will alert us more and can cause more sleep problems. Another tip for adjusting our own sleep schedules is to focus on waking up earlier. So even if I didn't get a lot of sleep last night, I'm going to keep trying to wake up earlier. And the hope is that by the time we get to evening again, I will be sleepier and more ready to sleep. And hopefully that will help reset my sleep schedule. And of course, it is important to try to have a consistent sleep and wake routine. This is one of the top sleep hygiene tips for ourselves and for our kids. And it's really best if once we get in a good routine where we're getting enough sleep, We want to try to keep that sleep schedule, that sleep routine, even on weekends and holidays. We know, again, not always easy for us or for our busy families, but we want to just try our best, because any positive changes towards having that consistent sleep schedule is going to really pay off. Okay. If you're still having sleep difficulties and you want to maybe do a little more detective work and seeing what's going on, you could try using a sleep diary. Sleep diaries are really helpful if we want to track our sleep over a longer period, and they can sometimes uncover information about the possible causes of our sleep difficulties. So, in a sleep journal, you might record things like, how long did it take you to fall asleep? How many times did you wake up? Or what's the quality of your sleep? How do you feel the next day? And you can find lots of different sleep journal templates. You can Google them, but this is one from Alberta Health Services. And so if you track, when you're falling asleep, when you're waking up, how many times you're waking, quality of sleep, etc., that information kind of over time might show some patterns. And that information that you gather might be really helpful to share with a doctor or therapist down the road. The next sleep hygiene strategy is making sure that our bodies are kind of ready for sleep. Our bodies don't get sleepy just because the clock says it's bedtime. Getting our minds and our bodies ready for sleep actually starts from the minute that we wake up. Our bodies, our emotions, our thinking abilities go through different levels of arousal during the day. When we wake up, our nervous system helps us to power up, become awake and alert. And then in order to sleep well at night, we need to make sure that we do power up in the morning and expend energy through the day. And then we need to gradually start to power down for bedtime. But if we have days where maybe we have lazy days where we do just kind of lay in bed or just watch movies or just kind of have low activity, we might find that it's hard to kind of fall asleep during those times. Where we have days where we're just kind of drowsy or in a hyper alert state. It might be hard to fall asleep on those nights because we haven't expended that energy, and our body does need to kind of be moving and expend that energy to sleep well at night. So for this reason, we do want to make sure that we really power up during the day. We need to also, again, power down at bedtime. And if we don't at bedtime, if we're still too active, we're not powering down, we might actually find that we become overtired, but actually become more hyper alert, more active, more energized, and kind of flooded with our emotions. So if we aren't kind of taking steps to power down, that activity can continue and increase, and we might be really worked up, even if we are tired. So again, we just need to prepare our sleep throughout the day by really powering up earlier in the day. Morning is great to get up, get out, and get some of that natural light, and then take steps to kind of power down in the evenings. Again, good sleep and physical activity are really closely related. Incorporating daily physical activity into our day, at least 30 minutes of physical activity, like heart pumping activity, into our day, 30 minutes for adults, 60 minutes for kids. It's a minimum recommendation. That sort of primes our bodies and builds that drive for sleep, kind of gives us that more of a sleep weight. It helps us make it easier for us to fall asleep and stay asleep throughout the night. So this is exercise, movement, heavy work, using our muscles, push, pull, lift, carry. All of that is going to help us to sleep at night. Exercise and movement prepares us to be tired at night, but not if we nap during the day, of course. So again, older children, teens, and adults should try to increase their nighttime sleeping to account for their sleep needs instead of always just going to that nap. Also, we need to power down at night. So let's avoid that sort of activity at least 1 hour before bedtime, if not, earlier. And again, I know we're thinking of our schedules. A lot of times, again, it might be, I've been grocery shopping at 11 o'clock at night, running through trying to get something for the next day. There's lots of things we do. We might be involved in activities with our kids at that time, but recognize that when we do that, we may be increasing our body's temperature. We might be really active. And it's hard again. Our bodies are tired, but now they're not ready for sleep, and it might take more time, which is going to delay our bedtime. So we want to make sure we avoid that activity at least an hour before bedtime. Okay, so I saw some questions coming in. We'll talk about some of those things at the end because we just want to get through some of this material. The number one environmental factor that impacts our sleep is light. And so light is that key factor. Bright light during the day, especially in the morning, helps to regulate our internal sleep clock, keeping us awake and alert. In the evening, it's the darkness that starts to signal our brain to produce melatonin, which helps us to sleep. So to support our sleep rhythm, we do need more light in the day. And so again, a lot of us work in darker areas, or we might, have softer lighting in the day. Let's get out, especially in the morning, get that bright light. And it's hard even in the winter time where it's so dark here. We may need to take steps and be more intentional about getting out when it's light and getting that light in during the day so our body is ready to produce that melatonin at night. And that's to dim our lights at night and give our body that signal that it is time for sleep. Of course, it's hard to reduce the light at night when we have that ability to bring bright screens with us wherever we go, even into our beds. Well, the blue light of these screens is like that light that we receive during the day. And the blue light can inhibit that melatonin production, and it impacts our ability to fall asleep or stay asleep. Also, the content that we view on our devices, maybe right before we go to bed, is often stimulating, and that can keep us up. And also, of course, our streaming services and our social media feeds, they're designed to keep us hooked. So for that reason and all those reasons, it is really recommended that all devices be put away at least for 1 hour before bedtime. And if you're not a person who does this, if you're a person who's normally lying in bed and going, I'm going to watch a few videos, I'm going to watch a show while I'm lying in bed to relax, we understand you need to relax. But encourage you just to try going without and seeing if that impacts the quality of your sleep. Putting that technology away, maybe grabbing a book or a magazine, or doing something else right before bed to help you to settle, something that still feels that you're connecting with time for yourself, but something else that you can do just to not have that technology. And then you might want to keep a sleep diary there too. See how that impacts your quality of sleep, how you're waking up the next day, how you're feeling. I think you'll be surprised. It makes a big difference. So I have a question. Does anybody here have any tips for managing their tech use around bedtime for themselves, for their kids? I know when my kids were little and tech was, something that they all were still on devices just before bed. I just got a light timer, attach it to my Wi-Fi, and just my Wi-Fi went off for all of us at a certain time, and that was it. We just didn't have access to those things. So that was something that worked for my family. I know it doesn't work for every family. What's something that might work for you or has worked for you? With regards to kind of managing and being on top of that tech use so that it doesn't impact your sleep. Someone says no devices in the bedroom. Yeah, you could just make that a rule for everybody, including the adults, right? Charge your phone in a different room away from a bedroom. Yeah, some people have docking stations like in their kitchen or in their dining area or living room. Yeah, somebody else said we use Wi-Fi too. Yeah, so if you can control some of that data or that Wi-Fi, some people use different apps for like parental controls to kind of shut off devices for kids and teens. Somebody says buying a conventional alarm clock instead of relying on the phone, right? I know a lot of us, I've got my phone, all my alarms right here with me on my phone. Don't use it for that. Just get a regular radio alarm clock or just other conventional alarm clock, a little wind up one even, just something instead of having to go on a device to manage that. So yeah, there's lots of different ways. Oh, somebody phone off kids in and kids bed phones off and not in kids' bedrooms at bedtime. I use my devices wellness mode so they can go grayscale when it's late. That's right. So there is technology that can help us where we can have that nighttime mode or wellness modes that shut that off so we can't access all those things that we could access in the daytime. I keep my device 5 feet away, and soft music helps me to get sleep in 5 to 8 minutes, or something like ocean wave music. Exactly. There are times when technology can really help us if we're using it wisely. So we'll talk more about that as well. Okay, everybody, thanks so much for sharing. Those are great ideas. So let's keep those in mind as we're intentional about how we use our tech and how it might be impacting our sleep. Another contributing factor for sleep problems, as we mentioned, is stress. Stress does keep our minds and our bodies on alert, causing tension in our bodies, and it keeps our mind racing. And we might be thinking of things we did in the day that we're kind of ruminating about, or worries about projecting about what's coming tomorrow. And so one time that we can reduce stress at bedtime is by trying to address our worries or our feelings and tension earlier in the day so that we can be calmer or more regulated and ready to sleep at bedtime. So this can include things like doing journal writing, where we express our worries and we get them out of our heads and onto the paper. And we do this maybe earlier in the day. We set some time aside right after supper to kind of get our thoughts out for our concerns coming up for the week or worries that we were carrying, so that we have it out of our heads and know that we can come back to that and look to that later if we need it. And in the same way, we can take a moment to write down those thoughts or those worries. And some people take a little jar and they put those worries in a jar, just to say, I can contain these. I can choose when I come back to these. But again, pull it out of our head and put it onto paper. Some people just go, I need to just go through my to-do list before I leave work for the day or before I get ready to settle for the night. If my bedtime routine is going to be starting at 8:30, then at 7:30, I'm going to just make sure I just check off. And so I can go to sleep knowing I've already got a list of knowing what to deal with tomorrow. And I don't have to think about it now. We can also set aside times in the moments in the day or in the week to talk with a trusted friend. We can also engage in, some of you mentioned this, in some relaxation techniques and deep breathing activities just before bed that can help us to settle. We can also end the day with some mindfulness or gratitude practices. And so that's where we help our mind to shift from a place of worry or the busyness of the day to a place of presence. And with that, let's practice one right now, if you don't mind. So I'm going to ask you, if you just have a moment of mindfulness here. Just get comfortable in your chair and take just a nice breath. We're just going to do a little reflection. Just if you don't mind, put your hand kind of on your chest, on your hand on your heart. Maybe just feel the warmth of your hand on your chest and your chest on your head. Now, I'd like you to reflect on one way that you are proud or pleased with yourself. Maybe think of the week you've had. What's one way that you're proud or pleased with yourself? Now, with all that you've carried this week, offer yourself a word of encouragement, whatever you need. Lastly, think of one thing that you can do for your own wellness today or tomorrow, something in the near future that you can do to support you. Let's take another breath. Wow, thanks, everyone. We can bring more of those moments into our day as we're settling down and getting ready for sleep. Short gratitude activities can be part of our everyday bedtime routines. And so bedtime routines are also important for getting our bodies ready for sleep. Our bodies are creatures of habit, and we're going to learn to associate certain activities or routines with that winding down. So before our bedtime routine, we might want to limit our liquid intake so we don't find ourselves running to the bathrooms all night. We also want to stop our caffeine intake earlier in the day. And bedtime routines could include, like, let's go around and dim the lights a little bit or turn off a lot of lights. Let's have a short or warm shower or bath. Let's have a light snack, but still a satisfying snack, maybe with a little bit of protein that's going to help kind of give us staying power to rest all night. Let's brush our teeth, go to the washroom, put on comfy sleepwear, and maybe ending all that with a calming activity, such as reading, listening to some calming music, or engaging in a relaxation practice. Whatever we do for our bedtime routine, we want to make sure that we're getting into a routine where things are consistent from day to day, where it's a simple routine that's not going to cause us more stress, but something that's just easy and just flows naturally. And we're going to do it also in under an hour in the hopes that We don't want to postpone that or have that process go on for too long, because we don't want our body just to settle down and get back into a cycle of being awake again. So we want to keep it kind of short and sweet and simple. So now we're going to quickly look at our sleep environment and how it can promote good quality sleep. Okay, so usually our bedroom is our sleep environment. And so we have a question. Just put it in the chat. How many of you use your bed for doing work or watching media? Who does that? I do that sometimes. For sure. I'm completely guilty of that. Anybody just say yes. If you do that, put that in the chat. Sometimes somebody says, nope, I like that. That's great. I do it too much. I do it occasionally. I watch TV, but I don't do work. I do it on weekends. Exactly, right? Again, this is something that we want to watch what we do, because, like I said, our bodies are creatures of habit. And I know that many of us have made our beds kind of an all-purpose space where we do lots of things, but one of the greatest tips for improving our sleep is to use our beds for sleep and intimacy only. With sleep, our brain does make really strong connections with our environment. And if we always use our bed to binge watch shows, to work on our laptops, our body's not going to associate our beds as a place to settle. And if you're having trouble falling asleep, it's really also in the same way best not to lie in bed awake for too long, because you're going to lie there and your body will associate wakefulness with that bed, and you're going to feel more stressed about not being able to fall asleep. So again, we don't want to have those distressing feelings in our bed. So if we can break that connection between our bed and wakefulness, if we can't sleep, it's okay to get up, do a calm, non-overly stimulating activity somewhere else till you start to feel sleepy again, and then you can gently bring yourself back to bed. We're not going to struggle with this. We're not going to be too stressed out if we can't sleep. When we're feeling that we're not able to sleep, we're lying in bed for a while, let's just get up and go, okay, I'll come back when I'm sleepy, and we'll engage in something not overly stimulating, but something, I mean, no devices there, something that's just going to be relaxing and help us to settle back into feeling sleepy again, and then we can return to the bed and keep that association of sleepiness and the bed. When thinking about our sleep environment, we also want to do some more detective work too, to see if there's anything in my environment that is actually impacting my sleep. We want to notice what we feel, what we see, what we smell, what we hear when we're lying in bed, and see if there's anything that might be more of a distraction or anything uncomfortable that leads us to a more restless sleep. So maybe your room gets too much light, or there's too many things distracting you. So besides keeping that technology out of your bed, we can change the lighting in our room to be softer, or we can switch to more amber lights to counter some of that blue light that's been emitted through the day. There are even smart light bulbs that can be programmed to change their hue as we get closer to bedtime. We could get some blackout curtains to block out, more sunlight, which can be really helpful, of course, in summer where it's light so early and so late. We can use sleep masks with our older teens and adults, and that can be helpful, especially if people that share a room, either our partners or our siblings. A sleep mask can be helpful for the older kids. And sometimes we're just stressed out because our room is full of reminders of things we need to get done. So maybe we declutter things, or we put the laundry piles elsewhere, or keep our workbooks somewhere else. So you might want to find other places to store distracting items. We also want to make sure that our room and our clothes and our bedding feel comfortable. So believe it or not, the ideal temperature for sleeping is between 16.5 and 20 degrees Celsius. Our body needs to be able to cool down in order to have good sleep. So with this, let's choose sleepwear and bedding that's just the right for the temperature and comfortable on the skin. And we don't want to do that activity right before bed, because we want to keep our body cool before bedtime. We might, engage in like a brief bath or a shower that's warm but not too hot, something that elevates our temperature a little bit, but then it can quickly come down. Will actually mimic and give a signal to our body that we're starting to get sleepy. We're starting to get ready for sleep. A quiet environment is also important for good quality sleep. So let's just turn off our notifications on our phones. Let's for older kids again, or teens and adults, really, we could use some of those soft earplugs to block out sounds, especially if a household with lots of people. And we can also bring in more sounds that are soothing, like people have mentioned, white noise, soft music, etc. So that can be helpful, especially if there's other noises in your home or building. And of course, there are some sleep apps. So I know we keep tech out of the bedroom, but sometimes it can be helpful. So there are different apps that have calming sleep stories or different sounds or music that can help you drift off to dreamland. And maybe there's others in your home that are also struggling with sleep. After they go to bed, do you watch a show? Do you do dishes? Do you run the washing machine? Your activity could be contributing to the sleep disturbances of others. So take notice of how your activity might contribute to the sounds of others in the home. And then what we smell also can impact our sleep. So keep that in mind if there's any scents that are alerting and note scents that are relaxing and can bring some more of those in. So before I could ask you for other tips for improving sleep, and I'm sure you've got some, so feel free to share those in the chat. But I want to say as we wrap up today, sometimes sleep hygiene isn't enough. We can do all the right things and still have difficulties with sleeping. Maybe we're having that insomnia, frequent night wakings, et cetera, et cetera. And so when we're having significant issues that are impacting our day-to-day life, issues with our children's sleep, kind of beyond those developmental changes, where even as we think about sleep, it's just thinking about it will increase our anxiety. Or as we go into our sleep routines, we've associated that with more anxiety around sleep, where it's actually increasing, just trying to get a handle on it. It can be really helpful at that time to consult with your family doctor or a mental health professional. Your doctor can check to see if there's any underlying health issues that could be contributing to some of these feelings or these physical challenges around that could contribute to sleep challenges. And mental health professionals can help with sleep issues by exploring any factors that are contributing to that stress and anxiety, as well as teaching relaxation techniques and exploring more targeted sleep hygiene strategies. And one common sleep disorder that we didn't mention is delayed sleep phase syndrome, which is a change in your biological clock that makes it difficult to fall asleep and wake up, and it causes some extreme daytime sleepiness. And so for this and other sleep disorders, a trained health professional can help you reset your clock. And there is a evidence-based therapy that is considered the most effective non-pharmacological treatment for chronic insomnia. It's CBTI, or cognitive behavioral therapy for insomnia. And it helps individuals to change unhelpful thoughts and habits to improve sleep quality. So you might want to talk to a mental health professional about CBTI. Thanks so much for hanging out with us today. I know we covered a lot of different things, and a lot of this you probably already knew, but hopefully you've been reminded of things, or we've come away with some ideas on how you can improve your own sleep or support better sleep for someone that you care for. And with all of this, don't try everything all at once. That would just add to your stress at bedtime. Just consider, are there one or two small changes that I can, easily make that can support my sleep, or try to incorporate just one or two things over the next couple of weeks. Pay attention to what's working and what's not. And you might find that even a few small changes can make a really big difference. If you're looking for more resources around sleep, My Health Alberta has some. Kelty Mental Health has some great information for parents on sleep struggles with children. And on the Alberta Health Services website, there's also information about the sleep disorders program at the U of A Hospital. You do need a referral from a professional for that, but there is more information on the website. Thank you so much. And here's some resources. If you'd like to talk to someone about sleep issues, mental health, substance use, for someone you know, for yourself, please reach out for supports, such as one of the helplines or programs here. You can also contact 211 Alberta for community resources, or speak to a nurse at HealthLink by calling 811. So thank you so much. It was great to be here today.
This was great. Thank you so much, Kathy and Denisa. I know we're right on time, so I'm going to keep my remarks short. I encourage everyone to share their takeaways in the chat if you want to. I have so many page of notes like usual, but I'll keep it moving along here. So yeah, please share your takeaways in the chat. We'll have the short survey at the end as well. So let me just retake over the sharing of the slides here. All the resources you see on the slides we'll share when we share the replay as well, so that everybody will have those. And all I want to say is, a big thank you to everyone who joined us, whether you're live here today or you're watching the replay. Please note that replay will be sent out to everyone who registered, if not this afternoon, then within the next day or so. Thank you again to our platinum sponsor, Ellis Dawn, for being here today and for supporting our entire 2024 Lunch and Learn series. We really appreciate it. We're still working on what the 2025 Lunch and Learn series might look like, so stay tuned for that. The best way, of course, to stay up to date with this series, as well as any other events and news that are happening here at the Mental Health Foundation, is to sign up for our newsletter and follow us on social media. So I'm going to go ahead and paste those links in the chat for everyone today, and we'll share these with the replay as well. Hopefully that copied okay. And the last thing I want to leave everyone with, speaking of what's happening here at the Mental Health Foundation, we're really excited to introduce our first ever holiday catalog called Hope for the Holidays, which is dedicated to improving mental health and addiction services across Alberta, featuring impactful gifts like art therapy kits, counseling sessions, and educational resources. Each purchase supports vital programs while offering meaningful presents to your loved ones. So this brand new catalog will be live in just a couple of weeks, allowing you to make a difference this holiday season. So stay tuned for more updates on that, more to come. And yeah, that's it. That's all. I wanted to announce that our annual fundraising breakfast is coming up on Tuesday, March 11th, 2025. We've been getting a lot of questions about that. So again, sign up for our newsletter, save the date, watch for it on social media because we're really excited to share more details on our website in a few weeks to come. So I'll let everyone go here. Please note there'll be a short 5-question survey that'll pop up as soon as the webinar ends. So we really, really would love to hear everyone's feedback. We're always working to improve these sessions, bring you topics that are relevant, like sleep, seem to resonate with a lot of you. So we'd really like to hear your feedback. So thanks again for attending. Thank you, Kathy and Anissa. Thank you, Ellis, Dawn. Everyone, take care of yourselves, prioritize your sleep, and we'll see you again soon. Bye for now.